MassBio is developing programs to create greater value for our members and drive positive change across the industry. One of the latest examples of this is our Edge Benefits program. We have partnered with Harvard Pilgrim Healthcare and Guardian Insurance Company to bring best-in-class benefits and premiums for health, dental, and ancillary insurance. We need all of our life science members to ask their broker for an Edge Benefits quote from Harvard Pilgrim. With January renewals right around the corner, this could be the best way to help drive cost savings for your company in the next year while helping to stabilize insurance costs for our industry in the long term. It's time to stop doing what you've always been doing and start working with partners that care about our industry and our patients. Thank you for your consideration.
Hi everyone, welcome to MassBio's Town Hall with President and CEO Bob Coughlin. I'm Jennifer Nason, Senior Director of Communications with MassBio, and we're thrilled to have with us today Katie Brandt, the Director of Caregiver Support Services and Public Relations in the Frontotemporal Disorders Unit at Massachusetts General Hospital, and a former and current caregiver to her late husband and father, and Paul Kidwell, a Public Relations, Patient Advocacy Consultant and caregiver to his wife. Welcome, Katie, Paul. Welcome, Bob. We're thrilled to have you.
Great to be here. Thanks.
Yeah, thank you for having us.
Perfect. So I'm going to dive in with some questions, but as always, we want this to be an interactive discussion. So audience, you can either use the live Q&A chat function, or you can ask questions right from the comments section. Now we're going to roll right in. We have a really important discussion today around the role of caregivers. So you are all caregivers to loved ones living with a medical condition. So can you, Katie and Paul, we all know a little bit about Bob's story, but I'm hoping each of you can tell us a little bit about your story. You know, how you balance your responsibilities as a caregiver with all the other demands in your life. Katie, why don't you get us started?
Sure, thank you so much. My professional role is as a director of caregiver supports, but I came to this work because of a personal experience. When I was 29, I was married, and my husband and I had a young son about to turn 1 year old when my husband was diagnosed with behavioral variant frontotemporal dementia. That's a progressive neurological disease that causes dementia, and there's currently no treatment or cure. Around that same time, my mother passed away unexpectedly, and my father was diagnosed at the age of 59 with Alzheimer's disease. So I was suddenly in a very unusual position of being a woman in her late 20s who now had the responsibility of caring for 2 adult men with progressive conditions that cause dementia and an infant son. But I was in the common position of being a family member with a loved one with a medical need who needed my support and care. And I think that one of the things we're going to talk about today is sort of the extended impact of when someone is diagnosed with a medical condition. How does that impact the caregivers, the family members in the orbit? And for me, I left my job. I used to work in the child welfare industry, and my husband and I did lose our home to foreclosure and spent every dime of our retirement savings, and I really focused on being a full-time caregiver for the next 4 years. My husband was lucky to receive care from an amazing skilled nursing facility and hospice program, and I was able to be his caregiver until the end of his life. And I'm still a caregiver for my father today. I kept him at home for 7 years, and now he is in the care of an amazing memory care program. My son is 12 and dealing with the challenges of remote learning. And with the support of these institutional care opportunities, I have been able to go back to work. And I'm able to bring my professional skill set in the policy and programming world with my personal passion to the work that I'm able to do in the MGH FTD unit. And I think that this dual perspective that I have from, being in the trenches myself, understanding the emotional, physical, and financial toll that caregiving can take, as well as working with families and helping them navigate the system in many different ways, has really given me this unique perspective.
Yeah, that's incredible. Thank you so much for sharing that story. Paul, what about you? Kind of what are your experiences as a caregiver?
Yeah, I think it's interesting that Katie references being in the trenches. I mean, I like Katie, I'm also involved in the life science industry, and sometimes that can be a blessing and or a curse because it arms you with information that otherwise, people not in our industry may not have and have access to, and so it makes you a bit of a smarter consumer. But at the same time, rather, sometimes knowledge is too much knowledge is not a good thing to have. I was confronted with a situation as a family member who's diagnosed with a chronic illness, and unbeknownst to me, thrust into a position that I had to react to, and that was 13 years ago, and it is my second full-time job, if you will, and it's something that we use the word balance, and I'm not sure if I've achieved that at this point because you never know when that need may crop up, and so creating a home life and a work life that has balance is a real challenge for me, and I think anybody in that role, and I think I don't know if anybody in the audience is also a caregiver, but I think they would also agree that achieving that balance is almost impossible because you are constantly in a reactive role, and so the demands on my life, trying to get those to coalesce with the demands of the other role that I have are almost impossible to imagine.
Yeah, I mean, you share a lot of that.
Yeah, and I'm so happy to be with you both, Paul and Katie, and obviously you, Jenny. We do a lot of these town halls, but this is a month that we celebrate patient advocacy, and the both of you are two longtime friends and colleagues and fellow patient advocates. And when you think of where our advocacy comes from, it comes from us being caregivers. And I can't help but think I never chose to be a caregiver or an advocate. That decision was made for us, right? And as a dad, 18 years ago, as many of you know, my wife and I had a beautiful baby who just happened to have cystic fibrosis, and it changed our world. And I think you're all being a little generous by calling me the caregiver, because I'm a caregiver on weekends and in evenings, but I had to work. And we were able to decide as parents between Christine and I have to give her credit for being the ultimate caregiver because she stopped working. Katie, like you had to, Christine stopped working when we had our third child, and working again just wasn't an option. So when you start to think about the challenges of caregiving and the sacrifices that need to be made and the decisions, the difficult family decisions that need to be made, that the challenges on siblings and other children and other family members, it's just something that's very difficult to explain to folks unless you've gone through it. And, it's, not being a doctor and not being a scientist, for me, it changed my career, right? I decided to leave what I was doing to work in this space so that I could feel like, when I wasn't at home, at least I was doing something that could help my own son and other sick people. And the story gets better because, over the course of 18 years, we're able to come up with a therapy, and he's doing really well right now. But the caregiving doesn't stop. And it's interesting because we've talked a lot lately about it. Bobby is an 18-year-old young man that's virtually going to college now. But even though he's an adult, as parents, you still don't stop being a caregiver, right? And we're trying to transfer more of the responsibility to him, but there's challenges with that. And I think it's important for us to spend a little time, Jenny, maybe talking about some of the indirect costs associated and the societal costs about being a caregiver. We already talked about You may not have both parents working, right? Or both members, both spouses working. There's all these different, it's expensive being sick, right? And it's not just the cost of drugs, it's the cost of everything, right? Parking at a hospital, buying meals remotely. You know, it's just, there's so many different indirect costs that are challenges for people that are in this situation, you know, that we need to really talk about and consider.
Yeah, let's talk about that. Maybe Paul and Katie, you can talk a little bit about, you know, what those indirect costs mean to you in terms of lost productivity, having to stop work, the emotional toll. You know, maybe Paul, you want to kick us off?
Sure. I think anybody in this role has to equate costs with time. And particularly as someone in my situation who, I mean, I'm the quintessential hired gun. People hire me for various projects and various work, but I'm not a salaried employee. So anything that takes me away from that is going to have a certain financial cost to it. You know, it's money I cannot make, money I cannot get back, if you will. And I always use this as an example because it's one thing that's a regular occurrence, I think, in anybody's life who fulfills this role, where you go in for a doctor appointment and there's, you know, pre-pandemic traffic was brutal, as everybody knows, here in Boston. And so even going the 6 miles that I have to go in from my home into town for a doctor's appointment can take me 1 hour each way, plus parking, plus the appointment. And so it results in, you know, anywhere from 2.5 to 3 hours out of your day that you cannot ever get back. There's just not enough hours in the day. And that's just those regularly scheduled events that occur. So, you know, what about the things that you have to react to, respond to, the unforeseen things where, you know, your attention is required. And so anytime you focus on that and that need, it takes you away from what you're supposed to be doing, if you will. And so I think it's an indirect cost, but it's a cost nonetheless.
Yeah,
I think that there's some real tangible ways that we could think about supporting. How can we help people stay in the workforce, and which is a positive thing for them because it helps them to continue to contribute in their field. It allows them to maintain those social relationships, which we know are so important for mental health and well-being. And there's a loss, right? So if you, like I did, if you leave the workforce, you may lose some of those water cooler friendships, right? Those work relationships, the opportunity to take a break from your caregiver role. So I have such a concrete example when we think about my husband living with a young onset dementia. There was no health insurance coverage for him to attend an adult day health program. So it was my role as the caregiver at home to provide that care and coverage. But on the opposite side, my father, who's a veteran, the Veterans Administration was able to cover the cost of his attendance at an adult day health program. So when my son stepped on the school bus to kindergarten and dad could go to an adult day health program, that gave me the ability to go back to work. And that was such an important freedom for me to continue to develop myself as a professional and as an adult, and also to contribute to our family's financial well-being. So when we think about what are tangible things that people in leadership can decide to do to help to alleviate these burdens, it's to think about supporting care the same way that we support prescriptions. Because I work with caregivers every day who are making care decisions based on finances. And if those care opportunities were covered, then I think that more people would have the opportunity to take a break from their caregiver role, to share the burden of care with the larger professional community, and to feel like that they were, you know, fully connected members of society.
And if I could just add to that, Katie, and I know this doesn't seem like a big deal to anyone who's a patient advocate or in the caregiving situation, but think about that. The ability for you to go back to work, that's good for your mental wellness. That's good for you so that you can have a life outside of caregiving, and it's good for the Commonwealth of Massachusetts and the United States of America because you're paying taxes, right? Your income tax. So when I meet with elected officials constantly, I say, not only is this the right thing to do for your constituents, this is the right thing to do for our economy, to provide that care. And even, hey, people don't like talking about it, but in the circles and the advocacy work that I do and the support groups that I'm involved with in the cystic fibrosis community, we talk about the divorce rate and people arguing about how should you best care for that child. Parents don't always agree. And it's hey, it's tough enough to stay married in this society anyway, never mind throwing something like that in the mix. And so you just think of the societal cost that is associated with care and with treatment and with these horrible situations that people are in. And anything that we can do in that department helps make us a better society, a more profitable society, and just it's better. It's better.
If I may, Jenny, you mentioned what I think is an important word to focus on, if not a state of mind, and that is the state of mind, the emotional well-being of people in our role. You are never not in that role, no matter how diverse of a life you live and how many distractions you may have. It's always in the back of your mind, the front of your mind. It's always there. You carry it around like a stone in your bag. And the stone becomes heavier at times, but nonetheless, it is there at all times. And I'm not sure if you can have a cost associated with that, because it takes its toll on individuals, and I'm not sure any kind of financial recompense may impact that role positively. But I think it is important to understand that, at least, and I think that's where. We talk about how our industry can respond to people in this role, at least an understanding that this is something that people struggle with a lot and they have to live with it all the time.
Yeah, at MassBio, we focus a lot on how the industry can better demonstrate the true value of these therapies, right? Not just in terms of making that person maybe healthy for that moment, but all the indirect costs they avoid down the road, both for the patient, healthcare system, and caregivers. So how do we get to that point? I mean, will we ever be able to truly measure all of those indirect costs? Because we know that there's pushback now in terms of the price of drugs. Entities like ICER are saying, oh, we won't pay for this, but they're not considering all those costs. Yeah. So how do we do this? How do we work together? How do we advocate for everyone to really see the full picture?
Well, again, Jenny, if you want to bring it back to that very specific outcome. So think about what is a clinically meaningful outcome for a family when we're thinking about the impact of a targeted treatment. Many adult day health programs need participants to be able to walk, to be able to participate safely in activities. And so what if there were a treatment that would help your loved one retain their motor function for longer? And then that would mean that they could attend the affordable adult day health program for longer, which would allow you to work and protect the financial security of your family for longer. That's just like one very specific example that can have this cascading effect of well-being and higher quality of life for multiple family and community members. And we know that caregiving is a threat to your health. We know that caregivers, dementia caregivers especially, have higher healthcare costs than non-caregivers. And so when I think about the cost to society, it's not just the person with the diagnosis, but there is this ripple effect. And so wouldn't it be great to reduce costs and increase quality of life for families?
Well, and I think it's, pardon me, I think it's the mere fact that it's now, at least in some circles, being acknowledged is important, because it used to be one of those things where it was acknowledged a little bit and yet nothing really ever was done about it. There was no discussions around it, no narratives around these people are important. They have a number of struggles in their lives. I mean, anybody in an advocacy role, I think, has these kinds of struggles. And I think the fact that industry is now paying a little bit of attention to it, but also I think it needs to expand. You mentioned some other groups, regulatory bodies. If they're not factoring this struggle in this role into their work, be it pricing and or approval. I think they're missing the boat a little bit.
Yeah, that's what drives me absolutely nuts about the ICERs of the world. They'll say, what is the value of this based on a quality of a patient's life, right? They don't take into consideration the fact that that patient might not be going to the hospital regularly now. What is the cost associated for the rest of the family? I mean, since my son started on Trikafta, I want to knock on simulated wood when I say this. He's made one visit to the hospital since he's been on this medicine. Granted, COVID is made it so that we can do telehealth visits. So think of things like telehealth and think of breakthrough therapies that change the course of the disease. We don't have a healthcare system. We have a sick care system. When are we going to have a healthcare system that will grab these 360 degrees of cost and value that these therapies bring to not just the patient, but society as well? When you're not going to the hospital, it's cheaper. Yeah, the drug may be more expensive, but as that expense of the pharmaceutical bucket goes up, the delivery bucket's going down exponentially, and nobody tracks it that way. So not just, the accounting of it's wrong, but also, and just another quick moment too, what companies are doing now. When you see companies that now have patient advocacy groups, they're trying to help the whole family, not just the patient. And that's a good thing. We need to do much better in this area, and I'm happy to say we're moving in that direction.
Well, and I also think that people in our position also need to place value. We I think have been sitting passively waiting for others to decide these issues for us, and I think it's an idea whose time has come for us to be more vocal and more proactive about our needs and how they may represent themselves in some of these areas like finances and just the acknowledgement of the important role that we play.
Yeah, and sorry, Katie, you looked like you were about to say something.
Well, Bob, I love what you're saying about the 360 wraparound. And so many of us are familiar with the phrase, it takes a village to raise a child. I think it takes a village to live a life. And I just love the idea of thinking about how can we look at people in a holistic way, their health, their well-being, and that family members are a part of a larger community, and that what's good for one person is good for a family, is good for society. And I think that we all need to look at how we can help each other in big and small ways to make those outcomes better.
You mentioned, Bob, the increasingly important role of patient advocacy within our industry and within companies. The fact that just anybody who's beyond phase one probably has some element of patient advocacy support, either internally or externally. And so I think the role that we're talking about today, I think also needs to be factored into that. Yes, you're reaching out to the patients and you're engaging them, but what about the other parts of their lives? Are you doing the same with them? And so I think it's important that industry, while I applaud them and I pat them on the back for now having vice presidents of patient advocacy and senior directors, I think they also have to perhaps even consider somebody who's involved in the care aspect, the caregiving aspect. Or at least have the knowledge and how it can impact, because it impacts the patient as well.
Absolutely.
Yeah, and I think we are seeing, like you said, biopharma companies are trying to incorporate that patient voice, but we still need to do it earlier, right? Even phase one is almost too late. So I think we can still work together to both have the industry focus on the patient, but also the caregiver. And I think you see that more often with diseases that impact children, right? You've definitely been a vocal advocate around that role as a caregiver and your wife. But I think, again, it's how can we continue to push that as an industry and to work with, the providers, the people that are providing care for these, sick children and adults on a daily basis. So I don't know, Kate, if you see any other kind of innovative strategies or ways that, maybe hospitals are trying to incorporate more of that sort of caregiver perspective.
Of course, I am so incredibly proud of the community programming that we've developed under the leadership of Dr. Brad Dickerson. And all of the care is not going to happen in clinic. And so it is so meaningful when clinics can identify Are families connected with their local support programs? Are they getting home health care? Are they connected with their disease organization, right? Whether that's the Alzheimer's Association or Cure PSP. And so I think the more that clinicians and physicians are able to direct families to those community connections, the more embedded and connected people will be.
I'm seeing an interesting phenomenon where historically you'd have the patient foundations, and they might incorporate an element of this within their practice. But now you're seeing national alliances dedicated, regardless of the patient advocacy area, they are just solely focused in on caring. And I think that's wonderful. I think that's a wonderful step in the direction, and it gives it gives our industry potential partners with whom to collaborate and maybe start drafting and directing some kind of policy that incorporates some of the issues that we're talking about today.
Yeah, absolutely. And I mean, I'm happy to report back that in the last 18 years that I've been involved with the Cystic Fibrosis Foundation, to see how the CF Foundation, the clinic at Boston Children's Hospital, and the patient advocacy group at a company like Vertex and many other companies now that are in the CF space, the communication and the collaboration that is happening between those three legs of the stool to ensure that the patient is the one on the seat, right? The patient is in the middle of it. They've come so far. And again, for what you do at Mass General with FTD, Katie, I mean, I know a family in my town that knows how much of an angel you are because you personally and your group helped make those connections to the foundation and to the clinic and to the right resources for family support outside. If they don't have that resource, they don't know what to do. And once you educate them and help point them in the direction, think of the quality of the life and the indirect costs that are diminished because they're hitting the ground running and treating and caregiving their loved one.
Right, because when you think of that communication that is directed at patients, that's going to assimilate into the other lives as well of their care team.
Yeah.
Yeah, we do have a question from the audience I want to get to quickly. I know we're almost at time. As always, these go by in a blink
Goes
of
by
an eye.
fast, doesn't it, guys? Just like we told you, it goes by real fast.
But Elena Spencer is asking, outside of influencing corporate benefits and advocacy policies, what is your advice to managers of caregivers? So managers of individuals with significant caregiving responsibilities, how can you support them on a day-to-day basis? Let's everyone go, one thing that you can support them. Katie, why don't you start?
I think it's a connection with your employee assistance program. And if you don't have one in your organization, figure out how you can bring some of those supports in, because they're amazing at offering those mental health supports. Some of them will offer connections with care managers. They'll run monthly support groups for staff members who are also caregiving, and really to say, this is so important that we are going to allow you to take that time off of work so that you can focus and organize and get the support you need. And then that will help them to be a better, more focused employee.
I also think it's just an acknowledgement of a conversation where I'm not going to be penalized if I have it with my manager or someone higher up within an organization. The fact that I can speak candidly to somebody and share some of this information with them and tell them that I probably will have to have some type of special consideration and not be penalized professionally, not lose my job. Yeah. I would want to have that comfort. And that's something that I think any manager could do. And if it's not already in existence within a company, they can start lobbying for that.
That's great. I would just say, just be compassionate. Try to get it. Put yourself in your employee's shoes and understand what they're going through. I think this has been such a life lesson for me that, Jenny, anyone who works here, if there's a family medical emergency, that always comes first. Because if people don't have their act together at home and they don't have their head screwed on right, they're not going to be a good worker. So partner with them and help them do that. And that's why everyone should work in this industry, because the people in the life sciences get it. It's awesome.
Thank you so much. Thank you, Bob. And thank you, Katie and Paul, for joining us. This was such an enlightening conversation. And we're going to continue this conversation on November 12th at the Patient Advocacy Summit. So please, everybody, go to massbio.org and register if you haven't already. And we hope to see you there. And thank you again.
Thanks,
Thanks,
everybody.
everybody.
Thank you, my friends. Thank
Take
you very
care.
much.
Bye.
Bye.